how would you recommend someone, if they're listening to this and they're trying to figure out, I hear this a lot where it's a goal of mine. I want to invest, right? I hear about it or I think about it. It sounds fabulous. Where do you start? Like, where does someone begin this process if that's a goal of theirs?
I would look for a realtor who is also an investor, because that would be the best person to actually introduce you to the field of the real estate investment. You can definitely talk to people who are already in there. I believe that there are some meetup groups that do that, and people just network and share their experiences. I prefer to do it one-on-one with somebody with whom you are comfortable and who is trustworthy. So I lucked out with Matt because I was like a sponge, constantly pumping him for the information that he graciously offered and absorbing it all. Because when you start selling somebody a house, what you do, you automatically notice the things that should be addressed. You automatically explain whom to talk to. You are very generous with sharing your sources, from contractors to mortgage specialists, etc. Because when you are in real estate, it's all in relationships. Because in our case, it could have stopped after my first acquisition, and then it could be somebody else. Right. Because we met by sheer happenstance through Zillow listing, and
Sure.
You were the realtor for this particular listing.
Right.
So we just hit it off and created a team that culminated in my continuous acquisition spree.
Yeah, your habit. I'm feeding your habit.
Yes, you are.
That's so funny. But so I wanted to get back to just some background on you. And so someone that's been able to jump into this as aggressively as you have. So I want to start with just a little bit about your background. So I know you just left Hopkins a few minutes ago to come here. So can you mind just sharing a little bit about your background and kind of
Not
what your
at
background
all.
is?
It's kind of curvy career path, but I am enjoying it. I'm a Gemini, so I'm pretty antsy, and I get bored easily. So for me, changing careers and exploring new opportunities kind of comes naturally. My education, my first education, was in environmental science. My dad was a world-renowned scientist, a geologist, a specialist in geothermal waters and oil geology. So I had to become a legacy, which I did, showed my dad my diploma and told him that now I want to go into linguistics. Dad was of an opinion that knowing languages is not by any stretch any kind of a profession. But since I already had something to fall back on, he said, like, okay, you want to learn languages, go ahead and do that. So that is what I did. And then...
How old were you when you made that switch?
I was 22. I was young.
Yeah.
And then when we moved to the States, basically, I decided that I do not want to do anything with environmental science because it called for very lengthy expeditions and field trips. And my husband was not very enamored with the idea of not seeing his wife for about 3 months in a row. So I started to think about what I would like to do. And at that point, I was working at the hospital, and I thought that something associated with medicine, like applied medicine, would be interesting. So I went back to school and got myself a first degree in health science, which turned into genetics, which turned into clinical genetics and public health. So when I got my doctorate, I was working at the lab for a couple of years, and then I got bored. Because
Which lab?
It was clinical genetics lab
At
Sinai.
At Sinai.
And it is wonderful, but by the same token, you do not see what you're doing. You do not have your instant gratification. So I decided that I would switch to the clinical research, which I did. And about that time, a friend approached me and asked me to join him in establishing a home care company. I didn't know about home care, pretty much nothing. And but I had my degree in health policy, so I said, like, okay, I can read.
Yeah.
So I started reading, and we decided to open at first a very niche home care company, which within
A home care company.
yes.
I don't even know what that means.
A home care company means that we, at that point, were providing only non-medical services.
Okay.
So that is assistance with activities of daily living, like bathing, feeding, toileting, transferring, ambulation, that kind of stuff.
It sounds like physical therapy.
Yes, but much less involved.
Okay.
It is literally helping people to live independently in their houses.
Okay.
This particular program was invented as a way to help people to avoid going to the nursing homes, so they could get everything that they need
And remain
in the
home.
comfort,
Right.
of their own homes. Then our patients started to ask for more involved care. So we opened a home health company, which provides any kind of post-acute care. Then they asked for the private care. So we did that branch. Then they started to ask for the physician's visits at home. So we opened nurse practitioner clinics. And the last one was so-called PERS, which is Personal Emergency Response Systems, which is a small devices that would alert us if the patient falls down or something happens and they need emergent care.
Right.
So that is how it all started. And we were doing it for a very long time, both in Maryland. We're doing it in Maryland, which is our headquarters, in North and South Carolinas, and in New Jersey. So it comes with its own challenges because it's never a dull moment when you are working with people. And that is interesting. And that is something that is very gratifying when you help people to live the lives that they thought were impossible. That kind of warms my heart. So that's how it was. And then, as I said, we moved to the assisted living model, which in turn moved me towards real estate investment.
Well, it's a logical. Now you've never laid it out that clearly to me. I feel like so it makes sense. It's not like you woke up one day and said, you know what, I'm just going to open an assisted living facility.